What happens in brain hemorrhage? A brain hemorrhage, also known as cerebral hemorrhage or intracranial hemorrhage, occurs when there is bleeding in the brain due to a ruptured blood vessel. This condition is considered a medical emergency, as it can lead to severe brain damage, disability, and even death. The severity of the symptoms and outcomes depends on the location and extent of the bleeding. There are different types of brain hemorrhages, including intracerebral hemorrhage. This occurs when a blood vessel within the brain ruptures and causes bleeding directly into the brain tissue. The accumulated blood can compress and damage brain cells, leading to neurological deficits. Subarachnoid hemorrhage. This type of hemorrhage involves bleeding in the space between the brain and the thin tissues that cover it, subarachnoid space. It is often caused by a ruptured aneurysm, a weakened and bulging blood vessel, or head trauma. Blood in the subarachnoid space can irritate the brain and its surrounding structures, causing symptoms such as a severe headache, often described as the worst headache of my life, nausea, vomiting, and altered consciousness. Symptoms of a brain hemorrhage may include sudden and severe headache. This is a common symptom of subarachnoid hemorrhage.
Nausea and vomiting. Nausea and vomiting.
Weakness or numbness in one side of the body or face, or on one side only. Loss of consciousness or altered level of consciousness. Confusion, difficulty speaking, or slurred speech.
Vision disturbances. Seizures.
Stiff neck. In the case of subarachnoid hemorrhage, the brain is a delicate organ, and when there is bleeding, it can lead to increased pressure inside the skull, a condition called intracranial pressure, ICP. High ICP can further damage brain tissue and compromise blood flow, leading to more severe neurological problems. Emergency medical attention is critical for someone suspected of having a brain hemorrhage. Diagnosis is typically made through a combination of medical history, physical examination, and imaging studies, such as a CT scan or MRI. Treatment may involve medications to control blood pressure, surgery to remove the clot or repair the damaged blood vessel, if possible, and management of associated complications. It's essential to remember that brain hemorrhages are serious and potentially life-threatening conditions.